advances in laparoscopy, bariatric surgery became a lot more safe and easier to recover from on the patients, allowed us to do things that we weren't able to do 20 years ago with open surgery. Laparoscopy as well and advances in technology allowed us to see better, visualize the tissues better, operate more efficient, and allowed us to achieve greater results and better success than we've ever had in the last 20 years. Our practice is so good at utilizing the most advanced technologies out there and all the devices that we need to do. And technology is finally catching up to what surgeons really thought of and wanted to do and achieve with these cases.
The safety profile of bariatric surgery has increased significantly over the last 2 decades. A lot of patients have concerns about their risk factors, about the safety of surgery, the risk of complications, and more. There's a lot of stories from the 1980s and 1990s of complications, which are real experiences born of open surgery, big incisions, risks for hernias, heart problems, lung problems. But a lot of those risk factors have been mitigated by advances in laparoscopic surgery, the visualization, improvements in the energy technology that we use to control blood vessels, the stapling technology that decreases bleeding and decreases the risk of intestinal complications. And so bariatric surgery now is very accessible, very safe, and the risks of bariatric surgery have decreased to the point where they're considered safer than a lot of orthopedic procedures, a lot of gynecologic procedures, cancer surgeries, and more. And bariatric surgery now could be performed with small incisions, and is really patients. Most of our patients are very surprised with how quick and how efficient their recovery is compared to what people in the 1980s and 1990s had to recover from.
And our goal as surgeons has always been to how can we use this technology? How can we take this improved understanding of surgery? How can we improve patient outcomes? How can we make decrease the patient's stay in the hospital, get you up and moving faster, minimize your pain? How can we minimize your risk of any kind of complications, make the surgery as safe as possible for you? And some of this technology has really allowed us to make large leaps in improvement of those, safety for patients. And we've been able to get patients moving faster, minimize their pain through using small incisions with smaller instruments, and patients really notice the outcome, and that's really what is gratifying in using this technology.
I think what also comes along with that is our ability to help patients recover faster from the surgery with a multimodal approach, different types of non-narcotic medications, and that avoids the narcotic side effects that also contribute to higher complication rates. People now just typically take extra strength Tylenol at home. They might put an ice pack on the incision, they walk around right away, and that's pretty much it. That's significantly different than what patients were experiencing about 10 or 20 years ago.
Now, not all surgery groups are probably equally adept at employing these techniques, which you have to take into account. I have many patients who tell me the day after surgery, in fact, this morning I had a patient say, I can't believe how good I feel. I read all these Facebook stories online about how they were horrible, they couldn't drink anything, they were in so much pain, they couldn't walk. He goes, I feel great. He had surgery last night. Can I get out of here? I'm drinking, I'm walking, I have no pain. And that's what all these advances have led to, whether it's technology improving from looking through a lighted tube to a camera to now 4K and 3D imaging so we can see and do things better, to, like Dr. Melman mentioned, the enhanced recovery pathway, learning how to kind of tone down all the body's reactions to surgery. And these improvements have directly caused patient improvements. So they do well, they feel good, and when you feel good and you're doing better and you're seeing improvements immediately, it changes your life. And that's what this is about.
Well, it's also not only evolution in technology, but also evolution in technique, application of research, having our ears to the latest advances and applying it to patient care so that ultimately they benefit with a faster recovery, a safer outcome, and basically return to their families a lot healthier and better than before. I mean, the past, 1980s, 1990s, that was basically we were learning a lot of things. And we're still learning a lot of things, but I think nowadays surgery is a very safe option, and it is surgery. So it's something pretty serious, but in our hands nowadays, it's a pretty safe option for curing a lot of metabolic diseases.
Yeah, I mean, I trained in late 90s, early 2000s. I don't want to give my age, but, and I've seen the evolution. I trained when laparoscopy first started. Laparoscopy was a baby when I was a resident in the late 1990s, early 2000s. And I've seen how we evolved from doing just gallbladder removals or cholecystectomies to now doing almost any procedure laparoscopically, including the most advanced cancer surgery laparoscopically and robotically for that matter. And I've seen how patients suffered from open incisions and how long they stayed in the hospital and how long the course of the recovery was and what they went through. And yes, I understand where all the history and all the thinking of how difficult it is comes from. But right now, I've seen the evolution, and I can tell you for a fact that it's a world of difference now. It's quicker, it's faster, it's safer. Patients are happier. Over the years of practicing and 15 years of practicing, the one thing I always hear is patients saying, I should have done this earlier. Which proves no matter what they went through, no matter how hard or how easy it was, they all have the same answer. I wish I did this earlier. That's what separates, I think, us from everybody else. And that's what we I'm just happy that everyone has the same thought process and everybody agrees on the same things. And what we agree on is you don't compromise quality. You always, number one is care for patient. Number two is make sure that they're successful, they're safe. We're doing this to help people get safer, become better, healthier, live longer, enjoy their families and their lives. That's our main goal. And with that, we train day in and day out. We practice safe medicine. We read studies. We apply current medicine. We try to stay current, even and in some procedures, we're even ahead of the curve. And in some procedures, we do things that some other places in the country haven't even started, looking into. All that because we want to get the best out of our surgeries, and we want to have the best for our patients. That's what built everything, is that patient care and that extreme interest in providing the most advanced surgical procedures.